Hi, I'm Sarah from New Thing Nurse, but today I'm here to tell you about Sarah, the radiology nurse, specifically the outpatient diagnostic imaging radiology nurse. Now, there's a lot of different kinds of radiology nurses. Some are interventional radiology, some are outpatient radiology, some are diagnostic imaging, also known as DI nurses. There's a lot of similarities in some parts of it, and there's a lot of differences. I'm going to talk to you today about working in the outpatient setting. A lot of radiology nurses work in the hospital setting, but I'm lucky, I think, to work in really amazing diagnostic imaging radiology clinic in the outpatient setting. What does my day look like? So I work day shift. We work 10 hours. I start at 7 a.m. and get off at 5:30. Pretty nice. When I go into work, I'm going in and first starting the day to make sure all of my supplies are set up, all my checks are done. The checks that I do are to make sure that our AET works in case anything crazy happens, because there's no rapid response. I'm not in a hospital setting. If a true emergency happens, it's me. We have a resident, radiology resident that can come in and help a little bit, and then 911. That's the situation. And for me, the former emergency nurse, that was something to get used to. So going back to my checks, I'm going to do my AccuChecks, checks, my QC checks on my AccuCheck machine or my glucometer. And then also we have an iStat machine that sometimes needs to be checked. And then I need to make sure that all my supplies are there. And what are the supplies that I generally do? So as a diagnostic imaging radiology nurse, I mostly am there for access, so IV access. So I start peripheral IVs and access ports as needed, and that IV access is to help with contrast, IV contrast for IV contrast studies. The types of imaging that we do at my clinic are MRI and CT scans or CAT scans. You might notice my shirt. And throughout the day, so I work 10 hours. After I do all my checks, our patients start having scan time starting at 7:30. MRI scans and CT scans take different amounts of time. CT scans are much quicker, and then MRI scans can take 45 minutes usually on average is our slot time from the time for them to sit down, get the IV access, get on the table, have the scan done, and get out of there. Some patients have multiple scans, so I might see one patient, put in an IV or access their port for one scan, 2 scans. Sometimes they have up to 3 appointments. We try not to do too many double and triple studies appointments because they are a long time for people to sit down or lay down for the scans. Throughout the day, I might put in 60 or more IVs or access ports. I am there to make sure that IV access is always working. If there's any questions about IV access, if it's been infiltrated or anything like that after the contrast goes in, I do the first check. If anything needs to be escalated, I escalate that to what we call our GAD-RAD, our radiology resident. And then I'm also there for any sort of reaction for contrast. And we have a set of medications for that for emergency. That's also part of my checks. I check our emergency medications. We also have in our greater clinic ecosystem, nuke med, PET studies, and some other departments and other service lines that sometimes I help support with IV access, accessing ports, or giving a little bit of medication. Some studies do require some medication to enhance the study. The most common medication that I usually give is glucagon, Zofran, and Zofran is for the nausea from the glucagon usually. Lasix is another common one, and I think those are the top 3 I would say I give up on a regular basis. The type of imaging for MRI and CT scan that we're doing is often for oncology patients for surveillance studies, so that they get scanned every 3 months, 6 months, once a year. Sometimes they're in treatment, sometimes there's after treatment. We also do scans for acute injuries or more acute issues. And then sometimes we're doing more research or specialty studies for people who have come into our greater healthcare organizations for treatment because we have specialty care throughout our system. Throughout the day, I'm running around, I'm helping getting patients changed out of their street clothes into our gowns for MRI, because that's part of an MRI safety protocol, or for CT, getting undressed however that needs to be undressed. MRI safety is a big piece of what we do. As the nurse, I'm one of the people that continue to ask the screening questions. If you are ever wondering about MRI safety, that can be a whole nother video, and maybe I'll do another one for that. And because it's important to know that MRI, the M stands for magnet, and any metal on your body or in your body has to be removed, ideally, or checked out before we get them onto the table for scan. I work really closely with MRI technologists, CT technologists, other imaging technologists. I would say they really run the show, and they are incredible professionals. It's really amazing, our team dynamic, and how well we can get so many patients through our little clinic every day, and getting them hopefully the best imaging that they can get for their diagnostic needs or treatment needs. A lot of people come in with a lot of anxiety. I think the other really common thing that we have to address as nurses in the radiology setting, for diagnostic imaging outpatient, is issues with claustrophobia for MRI, because people have a really hard time for many reasons sometimes getting in the smaller tube for our MRI scans. Our machine, we do have a wider bore, but it still can be kind of hard for our patients, so we do a lot of reassurance, a lot of time talking to our patients, connecting with them as we're dropping in the IV, making sure that they take their anti-anxiety medicines, and just making sure they're as comfortable as they can be to support the best imaging they can have, because these images are really key often to diagnostics or treatment programs that these patients have. I really love the field. It's really interesting. It's a really interesting intersection of technology and healthcare. Things are always changing. Things are always evolving with what we can do with our machines. But I do think that the fundamentals of safety, skilled communication, true collaboration, team dynamics are really important. If you're ever interested in learning more about radiology nursing, I highly recommend reaching out to Newthing Nurse at newthingnurse.com. Shoot me an email and I'll be happy to tell you more. Thank you for being here today. Make sure you like and subscribe, and more to come. Thank you so much.